Gynecomastia surgery is kind of a big word that is a little uncomfortable for most men, but what gynecomastia is really a female appearing breast or breast tissue on a male chest. And it's extremely common. Some statistics would say that 30 to 40% of men in kind of their middle ages 20 to 40, can have some form of gynecomastia. That statistic is bookended on either side of that age spectrum with an even higher statistic, meaning that youth, adolescents, ages 14 to 18, sometimes 60% of them will have gynecomastia. And men over the age of 50 also have rates as high as 60%. And there's two types of gynecomastia, or this more female shape to the male chest. There's what's called true gynecomastia, where there's actually breast tissue that is creating the shape of a female type chest on a man. And there's also what's called pseudo or fake gynecomastia, and this is just fatty tissue, not so much breast tissue, but fatty tissue that's accumulated in the chest that creates a little bit more fullness in the chest area. In either instance, the treatments are relatively straightforward and simple. There's usually some component of fatty tissue which is removed, which is like liposuction, and there's usually some direct excision where we make a small scar in the nipple area that's usually fairly well concealed, where we can remove some breast tissue that allows the chest to be flattened. It's interesting to note that men in cosmetic surgery are one of the fastest growing demographics in plastic surgery today. We see many men who just want a discreet, private consultation where no one else has to know about this, and we're sensitive to that here at Park Meadows. We'll make sure that our male patients aren't having to sit in our waiting room for an unreasonable amount of time. We know that can be uncomfortable, and we try to streamline the recovery process so that you see us an appropriate number of times to make sure that you're well cared for, but that you're not having to see the doctor more than you absolutely have to. And in general, this is a straightforward, simple operation with a recovery that is measured in a few days to a week initially, gradually increases in activity, and resumption of all normal strenuous exercises in about 4 to 6 weeks. Most of our patients are back at work within a few days after this procedure. Gynecomastia patients are probably some of the happiest patients we see today.